Do you have extreme hip pain that just won't go away and you want to get results quickly?
Well, you're in luck because we're going to show you 2 proven methods that clinically have worked for us, as well as a new treatment from a different angle, if you will.
Literally a different angle. Anyway, I suppose we should introduce ourselves.
Oh, there you go. I'm Brad.
I'm Mike, and behind the scenes we have Bob, and together we are the most famous physical therapy team on the internet.
In our opinion, of course, Mike.
So for this video, we're actually going to go back in time and take a clip from an older video with Bob and Brad in it, explaining one treatment option. What's that one?
Well, this one is actually a decompression technique that you can do at home. Now, this is an interesting video from past times because actually we pull Bob out of the scene. Bob becomes the camera person, and Liz, the camera person, becomes the patient. She does an excellent job. It has gotten millions of views.
So after that clip, make sure to stay tuned because when we come back here, we're going to show you another tip from our friend Rick Olderman, who is a world-renowned?
Yes, he is
physical therapist.
Yes, well respected. Now, these techniques are going to be particularly helpful if you have hip arthritis, labrum issues, or even a subluxed hip.
So I think we'll go back in time. You ready?
Yep. Woo, 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 woo.
Bob and Brad, the 2 most famous physical therapists on the internet.
So, and I mentioned this is relatively easy, and to do this, Liz volunteered to be our
yeah, 2 of them, I would say 2 of them are easy. One of them is, you'd probably need a therapist.
Yeah,
or
probably for the clinic. But we'll show you a little bit.
Yeah, we'll
of
show
that.
it to you anyway.
You bet.
We'll give you the whole schmear. All right, we're going to switch places.
Okay, now, I would expect you'll see the camera shaking and everything else going on with Bob back there, but just be patient.
That's
Everything
right.
will work out.
A rookie. I already shook it.
Okay, now Liz isn't mic'd up, so she may talk, but you may not hear. It's not that we don't want to hear, but for this purpose, this is okay. Are you ready, Bob?
I'm ready. Let's roll it.
Okay, so, with the person laying down, you could do it on the floor. It's kind of hard. On a bed, it works as the best place, just like this. Liz will be completely relaxed. Her right hip is the one with pain. When she walks on it, goes up and down steps because she gets that sharp pain. Simply what you're going to do is have the person relax and grab the ankle. And I'll just kind of wiggle the leg a little bit to make sure they're relaxed and not tense. And then gently pull this direction so we're putting traction on it. So, and I'll do this and say, how does that feel with a little pressure? I mean, just a little bit. And if the person says, oh, that feels kind of good, then I'll pull a little bit more. And if that feels better, I'm never going to get to the point where I'm pulling aggressively.
Brad, I want to make sure that people know, too, you would never do this with a total hip replacement.
Right,
yeah.
Right. This is someone, you wouldn't have arthritis in a total hip. So, if it's a total hip, it's time to go to the doctor.
Right,
and get the orthopedic surgeon to look at it. They'll probably take x-rays and whatnot. So I'll do that. Sometimes I'll pull on it, but it really won't respond well. So then I'll take the toes or the leg and internally rotate it slightly, just a little bit, not going to twist hard, just a little bit till it stops, and then I'll pull again and see how it responds there. And then I may go the other direction, because sometimes one direction, either inward or outward, can make a big difference on the reduction in pain.
It can reproduce. Oh, no, take away the pain is what I'm trying to say.
Abolish it, Bob.
Abolish it. How's that word?
And if none of those work, then I'll do this, and I'll abduct or go out to the side a little bit, and then I'll put a little traction on it. And also I can rotate outward or inward gently, and all this is gentle. You do not need to pull hard. If it's going to work, it's going to work really well, and the person will say, oh, that feels good. And then I've done it where I've just held people there for 30 seconds until I get too tired, and then I'll relax, and it can be real beneficial. If that works and the person's time to go home and they don't have anybody at home that can reproduce the treatment,
sure.
I'll have the person, why don't you get up, Liz? If they have a stairway or a stool at home, now, Liz, we're going to say it's her left hip so you can see it. Yep. Liz, I want you to stand here with your sore leg. You're going to stand up on your step and hold on to the braille, or here we got the booyah stick just because it's here and it works well. And really relax this leg, okay? And once you get it to relax, that's the traction. The weight of your leg is a traction, like me pulling. And then you're going to swing it forward and backwards gently. This is like the pendulum exercise for the shoulders, almost identical. Now, you can put an ankle weight on if it feels better.
And that's what Liz has in place
That's
right
what this
there.
orange is. Now, a lot of people don't have an ankle weight, but if you happen to live in a northern climate like we do, you can just put a pair of winter boots on. They weigh about a pound or two. Or steel toe boots if someone has some steel toe boots. Anything to get some weight. And the idea is to relax that leg and just swing it forward and backwards. There you go. How does that feel, Liz? She says it's incredible.
So Liz could have Wesley hang on to the leg there. So she's got a little 3-year-old.
Oh, yeah. Yeah, that would be good.
You know how they hold on to your legs when you try to walk?
All right, so you just saw a technique of traction, whether you're standing or lying down with another person. We're going to show exactly what's going on with that hip joint. So if we look closely here at the ball of the hip, when someone is lying down, we put some distal traction. We're going to pull the hip this way, and we're exaggerating the movement, of course, but when you pull this way and you have some problems, if that decreases the pain, it works very well. So there's relative motion this way, and then you can see we did a little rotation in the video. I'm not going to get too much more detailed. Now, this next technique, as we mentioned earlier in the video, actually pulls the joint in a different angle, literally. So we're going to actually move the hip backwards. There's a syndrome called
anterior femoral glide syndrome.
Thank you. And what happens is the ball of the hip goes too far forward, and we need to pull it back so it goes into the socket appropriately, decreases pain. Mike, can you show them how we do that?
So for this, you can try it with a belt at home, or if you happen to have some sort of large resistance band, you can use that as well. So you're going to need something sturdy to tie it to. So we have some stairs here. Brad, you may have to stay on this. I feel like I'm going to pull it over.
I'll help you out with
our stairs move. Yours shouldn't at home. Anyway, so all I'm going to do is face forward, and if I want to get that femoral head or my bone right here back in the socket like Brad was saying, I just lean forward and this band is going to pull it back. So you're going to relax, have my feet kind of staggered like this, lean forward, have a good upright posture, and this should feel good. If this hurts, then this stretch is not for you, but kind of go forward and lean. I try to do repetitions with this personally. If you'd rather just kind of sit here, you can do that as well for a prolonged period of time. Now, you can also get a different angle if you go sideways and then you pull. This is more of a distract. Oh, look at that. I can pull you right over. I'm pretty strong. Anyway, yeah, I just go this way, and sometimes this feels good too.
Now, I would say you probably may not have a strap like this, but if you have a belt from a larger person or two belts that you can put together, you can use one of these loop bands, the heavier one. The difference is, as you can see, there's some give to it.
I like that. I like the give. It feels nice. You can kind of I like to rock into it then when I have this, and I really like to exaggerate it and almost lunge forward and get that leg way back there. But this is just me personally. I don't have any extreme hip pain right now. But
you did at one time.
I still get some hip pain periodically.
Right.
Yeah, I get a grumpy hip.
But these techniques you actually use for yourself personally.
Yeah, they always feel good. Whenever I do these, I feel relief of tension afterwards. I have to keep doing my other exercises too, but this gets you kind of out of the discomfort zone right away.
There you go. All right, nice work.
You better look out before I slingshot this at you.
I know your tricks. All right, what else do we have?
We have another video if you're still having some hip pain, because in this one, it's more about getting some stretch and pain relief. There's not a lot of exercising in it, so you can click the video link on the screen if you want another option. 3 miracle exercises for hip pain.
Yeah, they're exercises. I think they're not so much stretching. I think you said that backwards.
Didn't I say it the right way?
Well, I don't know. I think if you watch a video, it will become clear, but it definitely gives you some options for that hip pain. Hip pain is a bummer.
I'm pretty sure I said it the right way. You just heard me wrong.
Well, that's possible. Have a good day and be careful.
Bob and Brad, the two most famous physical therapists on the internet.